Hi, welcome to the Lisa Saunders Show. I'm Lisa Saunders, and today I'm going to do things a little differently because I'm going to take you to Texas with me. Hi, I'm Lisa Saunders. Welcome to my show. And as you can see, I am not in my studio out of Groton, Connecticut. Where are we?
Can you guess? There's a clue behind me. We're in Austin, Texas.
And who are you?
I'm Dr. Drs Demmler-Harrison, and we are at the Congenital CMV Public Health and Policy meeting. And we're here to learn about the most common virus most people have never heard of. And that virus is CMV, or Cytomegalovirus. Most people don't know that it's a common congenital infection, and congenital means a baby is born with that virus. About 1% of all babies, 1 out of 100 babies, is actually born with this virus.
Wow, that's really a high percentage.
It is, and most people don't even know that their baby is infected with it. It is a very common birth defects virus. Babies acquire or get congenital CMV when their mother acquires or catches CMV, usually for the first time while they're pregnant. CMV is usually not a dangerous virus. Most people will be infected with it at some time in their life. So it's not weird, it's not unusual, it's not even scary to be infected with CMV unless you're pregnant. And if you're pregnant, you should know about CMV.
Now, what should you know about CMV?
You should actually take what I call the CMV knowledge vaccine. You should know that CMV exists, first of all. Most people, like I said, it's the most common virus most people have never heard of. So know that CMV exists. Look it up on the internet. Google it so you know that CMV exists. So an ounce of CMV awareness. And then the next component of the CMV knowledge vaccine is 3 simple hygiene precautions to reduce your risk of catching CMV while you're pregnant.
What are those risks? I mean, what do we do?
Well, so those simple precautions are, first, know that toddlers are literally hot zones for CMV. And toddlers, as adorable and affectionate as they are, can transmit this virus to us. So avoid kissing toddlers on or around the mouth or the lips because CMV is in their saliva. Avoid the one for mommy, one for you, sharing food and drink with your toddler.
Like sharing a cookie. So many times a toddler will take a bite of your cookie. You really should go get another cookie, right?
Exactly. You should have your glass when you're eating, and your toddler should have his or her glass. So,
and I know a lot of times a toddler will come up to a mom, take a sip from her cup, and moms are exhausted and don't feel like getting another cup. That's a big thing.
Exactly. So take that extra effort while you're pregnant to reduce that transmission.
And also right before you're pregnant, too, right?
Exactly. Yes, because if you acquire CMV at or around the time of your conception, the virus can get to your very vulnerable early pregnancy. And then the third component of the CMV knowledge vaccine, as I call it, is to wash your hands very carefully after wiping babies' drool and runny noses, because that's where CMV is. And also after changing diapers, all diapers, not just poopy diapers, but also wet diapers with just urine, because urine is where CMV actually is. So an ounce of CMV awareness, 3 simple hygiene precautions, and you can protect your baby from congenital CMV.
And about how many babies a year in the United States are born disabled by the virus?
Well, we estimate about 30,000 to 40,000 babies each year, year after year, are born congenitally infected. And there's probably between 3,000 and 5,000 of those babies that are severely affected permanently from congenital CMV.
And what are some of the disabilities or symptoms of that?
Well, babies who are severely affected from congenital CMV may have microcephaly, may have brain malformations or brain calcium. They may have vision loss. They may have hearing loss or deafness that may be in one ear or both ears. They may also have damage to their liver or to their spleen and to their bone marrow. So it's a very serious virus that can affect almost every organ. But there is also, so that's sort of the tip of the iceberg of congenital CMV, the severely affected babies. But then there's a silent majority of babies that are born congenitally infected with CMV that look normal, like every other newborn in the nursery, but yet they're born shedding large quantities of the virus in their urine and their saliva. And so what happens to them? Well, studies have shown that they actually have a very significant 1 out of 5 risk of having a slow, progressive deafness over the course of their life. So CMV can either affect your baby very early and have very obvious symptoms, or it can be stealth and kind of secret and silent and still cause your baby to go slowly deaf.
And a lot of people don't know why their child is losing their hearing, right? Isn't that?
Exactly. So it's estimated, there are many causes of hearing loss, but it's estimated that congenital CMV, especially silent congenital CMV, is a very common cause of slow progressive hearing loss in childhood.
I heard that was the leading cause of non-hereditary hearing loss.
Exactly, yes. You can have hereditary hearing loss. You can have hearing loss from malformations of your ear or your brain. And then there are the infectious causes of congenital hearing loss, and CMV is number one.
Well, Dr. Gale, people can find out more by going to your website. Tell what your title is there.
Well, we are on Facebook. We are on Twitter. We have a website. It is...
what's it called, the organization?
It's the Congenital CMV Registry, Research, and Clinic. So if you Google that, you can find us. We're on the web. We're here to help you. We're help to spread CMV awareness, to help you keep your pregnancy safe and your unborn baby safe from congenital CMV.
And what hospital site is that on?
It is at Baylor College of Medicine, and I also have a blog at Texas Children's Hospital as well.
All right. Dr. Gale, thank you so much for sharing this information with us from Austin,
We
Texas.
are from Austin, Texas, and we're with Willie Nelson,
Yes.
and we're here to learn about the most common virus that you've never heard of, but now you have, CMV.
Thank you. Bye.
Hi, my name is Carolyn Bailey. I am 26 years old, and I am a master's student at the University of Texas in Austin. I'm studying community and regional planning. And I'm here at this conference today because I was born with congenital cytomegalovirus. And I wanted to kind of share my story here today. When I was born, I was in the hospital for 10 weeks, and the Dr. Demmler, who is now Dr. Harrison, decided to try and give me a higher dosage of ganciclovir in order to prevent some of the side effects from CMV. And it's thanks to her and to her hard work that I am here today, that I was only in the hospital for 10 weeks when I was born, and the only thing that I still have from that is my deafness. So I am profoundly deaf. I have a cochlear implant and a hearing aid, but I like to think I do pretty well in the world. I don't think I need much more than that, but it's so surprising to me that more than 25 years after I was born, that so many babies are still being infected with congenital CMV. And what can we do to increase awareness and let more people know about this disease? It should be really just as well known as the Zika virus, because the Zika virus and congenital CMV do many of the same things. And so that's why I'm here today. I'm glad to be able to share my story and hopefully inspire people to take further action on this.
Thank you. As you watched the videos, you probably realize all women of childbearing age should learn about CMV so they can know how to prevent it. Women who care for toddlers are especially at an increased risk. In fact, every year, 8 to 20% of caregivers do contract it. The American Academy of Pediatrics recommends caregivers be advised of their increased exposure to CMV and the importance of meticulous hand hygiene. Hand washing and avoiding contact with urine, saliva, and nasal secretions does lower your risk. Today I'm going to interview pediatrician Dr. K. Balch. Dr. Balch and I worked together to get a CMV law passed in Connecticut in 2015. Welcome, Dr. Balch.
Thanks for having me, Lisa.
So just tell us all, who are you and what do you do?
I've been a pediatrician for over 25 years, and I've worked for the past 10 years with the American Academy of Pediatrics Early Hearing Detection and Intervention Program as their chapter champion. Every state has a chapter champion, some states have two, and our goal with the Early Hearing Detection and Intervention Program is to teach physicians and others about hearing loss.
So what did you do exactly with the bill? Tell us what the bill was that we brought them.
Together with other parents and physicians, we helped to get a bill passed in 2015. The initial bill had two components. The first component was for education of parents, daycare providers, anyone who deals with toddlers, hospitals, and physicians about CMV, what CMV was and is, and how you can prevent the spread of CMV. The second component was to test children who had hearing loss diagnosed in the newborn period for CMV to see if that was the cause of their CMV.
Now, one thing, when I was talking to legislators, if you weren't with me, they'd say, well, are we already testing hearing? Because they thought if we weren't already testing hearing, that's complicating everything. But then I got back to you, you were quite my quick dial a fact or whatever, and you said, yes, Connecticut, it's law that all newborns have to have their hearing screened, right?
Across the country, we're doing a pretty good job testing all newborns with a newborn hearing screen for hearing loss. And we've been doing that since the year 2000 in the state of Connecticut, and we're up to majority, 99+% of infants are tested for hearing loss in the newborn period.
And I think that's most states except for a few.
And most states have that percentage as well.
And that's just good for other states to realize that they probably already have that in place for those who watch our show and realize they would like to get a law passed too, if they're not getting CMV awareness in their state. So what we wanted a lot to get passed, but we didn't get it all. So just explain what did get passed.
So because of financial restraints for the state, which is something that's common in lots of states across the country, we weren't able to get the education component passed. We were able to get the testing component passed. So in the state of Connecticut, since January 1st, 2016, all newborns who do not pass their hearing screen are tested for CMV. And because we got this part of the law passed, we're not able to do testing of babies without explaining why we're doing testing. So the Department of Public Health was able to develop a number of resource materials for parents. So at the hospital, they receive a brochure not only on hearing loss, but also on CMV and why we are testing for CMV. Hospitals were given flow charts to know what the new law involved and what to do with regards to testing. And we developed a fact sheet, the Department of Public Health and myself, we developed a fact sheet for primary care providers, pediatricians on CMV. And then most recently, we developed a package that we're sent to OBGYNs on CMV, including a poster, a cover letter, and a couple other fact sheets for OBGYNs and what's relevant to them in their practice. In addition, there was available in late 2015, prior to the law being instituted in January of 2016, a webinar was developed. Dr. Bennett, who is an infectious disease specialist at Connecticut Children's Hospital, developed a webinar that was available initially to primary care providers and pediatricians, but is also, the resource for that is on the website of DPH.
I loved it because I was so great because a lot of times I can't get into these secret doctor articles. You have to be registered or licensed or something. But it was great that I could watch it, and I loved his English accent. And
it was very well done and very well received.
It was, and and I learned a lot about it too. And he made a comment that he's kind of surprised that this just doesn't get the attention in this country, CMV, as it does in other countries. Because I thought it was interesting that in Queensland, Australia, daycare providers, if they're childbearing age, want to become pregnant or think they're pregnant, they're not allowed to work with children under 2. And in Germany, they'll test your blood for the antibodies for it, and if you don't have any antibodies for it, you are not allowed to professionally care for children under 3. So other countries are doing something. Like I said, it's not great worldwide, but anyway.
Right. Presently, it's not routine to test moms for CMV to find out if they're seronegative or seropositive for CMV. And studies show that women in the United States of childbearing age, about 50% of them are seronegative or have not acquired CMV yet. So in the primary infection, which is what they're seronegative for, is a very serious infection if they acquire it during their pregnancy or shortly before they become pregnant, because then they can pass CMV to their unborn child, and their newborn may be born with problems associated with CMV infection.
So I know the blood test can't tell you everything, but I think doctors have all decided, but prevention is still key, because even if you have the antibodies for it, there could be another strain. So everybody really has to be diligent about their hand washing and avoiding saliva.
Right. In the United States, although most commonly those who get CMV during pregnancy are those who've never been exposed to CMV and contracted it, you still can pass CMV to your unborn child if the CMV infection you have is reactivated, or you can get a different strain of CMV, and so you still could pass it to your child.
I was excited about one of the flyers you got because it's great. This is put out by the National CMV Foundation, and they have a lot of flyers. You can go right to their website and you can download these flyers, and they're high resolution. And you contacted them, and
yes, the Department of Public Health, the Connecticut Department of Public Health, whom I work with, contacted them and got permission to use their logo on their poster, and so we made copies of this for all the OBGYN offices and sent them out in that packet that I was speaking about earlier.
And I love that because now people don't have to reinvent the wheels. This is something any state can do if they contact the National CMV Foundation. They can help them provide these materials because these are nicely designed. I don't know how to design anything or print anything, and now because we didn't get funding for the CMV bill, you guys didn't have funds to create all these nice looking posters.
Correct.
So.
No, there's a lot of resources out there. One thing that I have found being involved with the Early Hearing Detection and Intervention Program, there's a national conference every year, and it's a wonderful conference, very passionate people who are concerned about hearing loss and making sure that kids get interventions early on to optimize outcomes, and they're always willing to share their materials. When we were looking to pass legislation in Connecticut, we went to Utah and used a lot of their information and resources since they were the first state in the country to pass CMV legislation. And we used a lot of their resources and information in order to help us find a way to pass this legislation in Connecticut.
And they've helped a lot of other states pass legislation, Texas, Illinois, Idaho just passed.
Recently. Mm-hmm.
So it's just exciting because state after state is looking at, I think, their template, because that's what I use. I downloaded their bill that they got passed and took it to my legislator. I had no idea how to get a law passed because unfortunately I don't really know how the government works. Because I'm a writer and I always write about dead people because they never complain. So I don't know how the real world works. So I had to go to the town hall in Groton, and I asked the dog license lady, I said, how does the government work and how do I get a law passed? And she told me. It was great. The town clerk.
Well, you worked very hard in getting the law passed, and you kept us all in line to make sure that we testified or sent in testimonies in order to get this law passed. And we have you to thank, Lisa.
Well, and the other moms. So remember when we saw
and the
Casey
other moms as well,
testify?
yes.
Wow, she was just so elegant.
And passionate.
Yeah, she was wonderful. And other moms, a lot of moms can't make it to testify because their
Right.
children are sick. So that can make it hard for legislators to realize moms would love this, would love a law like this so that it can prevent future babies. Because we're all heartbroken that we didn't know, that we weren't given a chance. Because I know some doctors may feel, well, it's kind of impossible if you have your own toddler. But I didn't know, I wasn't given a chance to know that I shouldn't have shared a cookie or that I needed to be more careful after picking up toys, that I should have washed my hands first. So it's a painful thing to moms like me who weren't even given a shot at protecting my unborn child because according to several studies, Dr. Stuart Adler analyzed them in an article, and he said they all show that if you tell a pregnant woman about CMV and the prevention measures to take, she can reduce her chances of contracting it by over 75%. And I think that's amazing.
It is amazing. And there's several studies out there that show that hygiene interventions can make a difference in spreading the disease. And just to reiterate, because I think these things are very important, and Dr. Demmler-Harrison mentioned them in the video, is number one, if you're pregnant or planning on becoming pregnant, you want to make sure you don't share cups and you don't share utensils and you don't share food. And you want to make sure that you try to kiss your child on the top of the head as opposed to on the lips. You want to wash your hands after dealing with nasal secretions or saliva. You want to always wash your hands after changing diapers, whether they're stool or they're urine diapers. And you want to also be careful with toys that may have saliva or other bodily fluids on them.
For years, I've been trying to raise awareness. My daughter was born in 1989, and I was a licensed daycare provider, and after she was born, that's when I got the information that daycare providers are at increased risk. And I have been trying since she was born to raise awareness. I'm a writer, so I'm writing articles. I ended up writing a book, Anything But a Dog. And yeah, it would get a little bit of publicity, people would read it, but no, there was no serious change. So I can't tell you how excited I was in my little Google alerts that I get on the disease when I saw that come in from Utah, that somebody actually got a law passed. And I have to say, I hate to bug people about another law or make anybody do anything. But I tried for years, and so did a lot, Dr. Demmler-Harrison. A lot of us have tried for years to raise awareness, and nothing came of it. But these laws seem to be changing things.
Well, unfortunately, sometimes that's the way we need to approach things. The universal newborn hearing screen was a law, and that's why we do what we do with regards to universal newborn hearing screens. And these CMV laws are making a difference and will continue to make a difference. It would be nice not to have a law in order to get education out there about this disease and about how you can impact and change acquisition of this disease. But presently, that seems to be the only thing that's working.
Right, and it does seem to be working and giving us all moms hope because, like I said, we all feel sad, but it helps defray some of our sadness if we can prevent it from happening to somebody else's child. Because a lot of moms that I'm busy with, on Facebook groups and my CMV news site, we're all just as equally passionate because we can't rewind the clock on our children, but it is a way to fight sadness. So I recommend for any parent that wants to see change happen to contact their legislator. And if you don't know how the world works, you can go to your town clerk. Right. I don't know, states are different,
right.
but
every state is different.
But there must be somebody local that you can physically see and say, how do I even get started? So there are ways to do it, and you can go to your state's website and it'll say how to get a law passed or something. And when I read Connecticut's, I was so discouraged because, oh my gosh, you have to get this committee to pass it, then you got to get the House to pass it, then the Senate, and even
the
still
public health committees are important.
Yeah, and even then the governor may not sign it, so I was on pins and needles. So it didn't pass in 2014, and I cried my eyes out.
I remember that.
It was such hard work.
That.
But people from Utah contacted me, and my own legislator contacted. Don't give up, please. This happens. It can take years sometimes.
Perseverance.
Yes. So anyway, so thank you for all your help, and like I said, to the other parents and medical professionals, and a lot of my friends wrote in, and people from other states wrote in, because technically our legislators, Connecticut legislators, don't care what other states say, but they did care. When I went to the Public Health Committee, they said, we got a lot of testimonies, over 100, and there were a lot of them for other states, so I really appreciate the other parents and doctors.
I agree.
Because it just was the wind beneath my wings as I was trying to figure this out, but then the ball really got rolling in Connecticut as more parents got involved, and you were just a bulldog having people over and get this law.
Well, women have a right to be educated about CMV, and women of childbearing age have a right to know what they might be able to do to prevent the spread of the disease. So it's important.
I know, because I know doctors don't want to frighten people, and I know daycare employers don't want to frighten people.
At the same time,
but we need a chance.
They've done studies to show that moms who are childbearing age are not resistant to learning about CMV. They want to make their own decisions about what they can do to prevent things, and they're not afraid to know about it.
It is a woman's right to know. I mean, because I thought if you go to your doctor, you're going to learn everything. But I've since learned, as you get older, you realize you always have to research more because people only have so much time to give you an appointment. So I think it's really critical to go to your state's website. Connecticut Department of Health, you've done beautiful work with them to get all this CMV information on there, and especially for child care providers. I love it. I can quote from it now.
Right. There's two websites that I would go to if you're really looking for information on CMV, more information. We can't obviously give you everything out there. The one is the Connecticut DPH website. So it's ct.gov. /DPH, and then you do a search for CMV, and there's a ton of material on the website for parents, for hospitals, for physicians. There's the webinar you can look at, Dr. Bennett did from CCMC. And then also the CDC website, cdc.gov/CMV, and they have a lot of information on CMV as well.
And they have good information on hand washing, because a lot of people don't wash their hands for 20 seconds, and there's just a lot. You got to remember to take a paper towel off and then turn off the handle. So there are ways of effectively washing your hands.
That's true. One of the theories they did studies on healthcare providers and exposure to toddlers, healthcare providers who have childbearing age, and they found that the incidence of CMV in those healthcare providers was equal to the general population.
Yes.
So that suggests that something that they're doing in the healthcare environment is different than what they're doing in daycare environments, for example.
Right. That's really, to me, proof that these hygiene measures really work.
Right.
Because nurses, they're all really careful when they're washing their hands and dealing with nasal secretions. And they know, because nurses are surprised that I didn't know about it. Oh, we all wash our hands. I'm thinking, but the general public, we don't realize, we just think that maybe we're preventing a cold, and why go through all this aggravation,
right.
Just to prevent a cold, but it's much more serious.
Studies show that parents and moms of childbearing age are unaware that actually the awareness of CMV has gone down rather than up in the most recent health study.
Was 9%. Only knew about it.
Only knew about CMV.
9% of women knew about CMV,
right.
And I'm thinking that's outrageous.
That's concerning.
Yeah.
And so if you don't know about these kinds of things that can be spread through saliva or through urine, then you may not be as aggressive in trying to prevent the spread.
I would love to find out who got the "don't change the kitty litter" rule out there, because I try to get to the source. What mom or doctor was behind that? Because I've known that for years. Everybody knows that. Even men know that.
Right.
That, darn, my wife's pregnant, I have to change the kitty litter.
Right.
Because she's not allowed to. So, but toxoplasmosis causes that's the kitty litter disease, that causes even fewer birth defects than CMV.
That's true.
It's important that we get the word out there. Well, we only have about a minute left. Is there anything else we wish we had said? I do want people to go also to Dr. Demmler-Harrison's website in the beginning of the video, because she has a lot of information on the registry and what they've been doing for years. Like I said, there's some really great foundations out there.
There are. And the Connecticut DPH website has a number of them.
Department of Health, yes.
Department of Health has a number of those websites on their website.
Yeah, so you can go there, because I did notice I could go there and then go to other sites. So thank you so much, Dr. Balch, for coming in.
Thanks for
having
me.
We'll just keep working together.
Yes, we will.
And prevent this terrible thing. Thank you so much for joining me on the Lisa Saunders Show, and I will see you next week. So long.